alternative drugs. April is National Cancer Control Month, designed to promote cancer prevention, encourage screening, and highlighting resources for survivors. We've got Dr. John Morton in studio with us today. He's a radiologist with Northwest Radiology Network. Doctor, great to have you here.
Thank you.
Routine screenings are so important for all of us. Can you give our viewers a good idea of when they should undergo these screenings?
Sure. Yeah, screening is really important because it just really nip the problem in the bud. It's really important to start off for breast cancer. Mammograms starting at age 35 to 40 every year is a good place to start for mammograms. For colon cancer, you need to get your stool checked for blood every year. You need to go see your doctor and get that done. If you don't go see your doctor, you can do the Cologuard thing you see on TV, the little kit. I would do that. That's really important. Lung cancer screening is really important for smokers. There's a new, fairly new study, CAT scan, low-dose CAT scan of the chest is the best way to look for small early lung cancers. Chest X-ray is okay, but chest X-ray is not as sensitive as a CAT scan, and so CAT scans are really good for that. For your skin, you need to see your dermatologist once a year to get your skin checked out. Yep. Those are the main ones.
Now, you work with PET-CT scans.
Right.
What does that do?
A PET-CT scan it's a kind of a new tool. It helps us find cancer, basically, and it's a CAT scan and a PET scan together. There's two different things. A CAT scan is a cross-sectional imaging study that shows you the entire body. Right. And the PET scan, we inject radioactive glucose into the patient. If the patient has a tumor, the tumor cells, the tumor is not as developed as your normal cells, and they can only use glucose. So the tumors have to have glucose, and the PET scan shows you where the glucose is, and we merge the two scans together, and you can see where the active the glucose is, the tumor.
A lot of the images that we're seeing here on the TV screen give us an idea of this. What are the benefits to patients here in going through this kind of scan?
Well, the PET scan is a couple different things. It's for if you see a lump on a CAT scan, you're not sure what it is, the PET scan can help you find out if it's cancer, so you can make the diagnosis of cancer. It can also help. It helps the oncologist with the treatment. One other thing it does, you see the primary tumor, you can see if there's other disease at the time of initial diagnosis. That's really important to see if the cancer is spread. So it helps the oncologist know how extensive the cancer is. That's really important. The other thing it really is good for, the oncologist will treat the patient with their chemotherapy, radiation therapy, and then they'll evaluate the patient like 6 months later, 3 months later, to see if the cancer's gone or not. Yeah. The cancer can be gone, it can be worse, it can be better. They can change their therapy based on what they see.
It's great to have you here, and it's so important that our viewers do get screened. Those screenings can be so important. Dr. Morton, thank you.